Hi, Dr. 𝗵𝗂𝗂𝗁𝗃 again with Gonstead Physical Medicine. I am talking about some of the treatments that we do for the TMD, Temporomandibular Joint Disorders. So in our last videos, I talked about the anatomy. I also talked about the prevention, the treatment, the diagnosis of TMD. And there are a lot of things that one can do at home to relieve temporomandibular joint disorder. But it might not be enough if you have a serious disorder that's been neglected for a little while. You might need professional help, and Gonstead Physical Medicine is an excellent place to start. So what we do with patients who come in with TMD is we start with an exam of the TMJ joint and of the neck. We watch you track and see how you're opening and closing your mouth so that we know how to adjust this area. And we do actually physically go in and adjust the joint, whether it's on the right side or the left side. The next thing we'll be examining is your neck. And as we talked about in your last video, the neck is very involved in the TMJ because you can have subluxations of the neck, which just means that you're not tracking right in your vertebra. You might have disc issues in your neck. You might have muscular issues in your neck. And we x-ray you so that we know exactly how to treat your neck. And lots of chiropractors will do that, treat the TMJ and treat the neck. But we have something else in our little bag of tools, which is the decompression machine. The decompression machine, the DRX9000C, is very effective for treating neck disc issues, which can, again, contribute to the TMJ. So we would be doing TMJ adjusting, neck adjusting. We have the decompression machine if it's needed, and we also have therapy and massage. So you might think, massage, how is massage going to help the TMJ? It's not your typical rub down that you get at the spa, and it's not even the massage that you get in a massage chair where you're sitting and you're looking down. Our massage therapists work specifically on the muscles of the head, the jaw, and the neck, going in there and getting each muscle to release the trigger points. We also have rehabilitation exercises that we do with our therapists, and we have red light therapy and EMS therapy, mostly for the neck area to rehabilitate that area. Lastly, you probably also want to see your dentist. Your dentist will be able to work with some of the teeth issues that we don't deal with. But your dentist can't do everything for your neck and your jaw, so you probably have to do them in combination. Go see your dentist. Come see us at Gonstead Physical Medicine. We look forward to hearing you and helping you.